Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Dracopolis Ideas Lab, all on your time, live or on demand. This is CSIS Online.
I'm Jacob Kurtzer, Director and Senior Fellow of the Humanitarian Agenda at the Center for Strategic and International Studies. Armed violence between Hamas and Israel is now in its second week, and the humanitarian toll is already very significant. Over 200 Palestinians in Gaza have been killed by Israeli airstrikes, while 12 Israelis have been killed by Hamas rocket fire. Gaza was already experiencing humanitarian stress as a result of multiple rounds of violence with Israel, along with the many years of blockade by Israel and Egypt, inhibiting the reconstruction of essential infrastructure and impeding the movement of equipment, personnel, and the obstruction of humanitarian access. Prior to the onset of the violence, Gaza was also experiencing a troubling wave of COVID-19 cases. As the violence continues, the humanitarian toll is rising, with urgent needs overwhelming the existing capacities to respond. The long-term picture is equally bleak, as the enduring cost of this conflict will be felt for many years. To help us understand the priority humanitarian issues, we're grateful to be joined today by Dr. Elizabeth Campbell, Director of the UNRWA Office in Washington, D.C., and Dr. Zaher Sahloul, President and co-founder of MedGlobal. Thank you both for joining us. I'd like to start with you, Dr. Campbell. Can you just tell us a little bit about the current situation? What are you hearing from your staff in Gaza? And what is UNRWA's immediate response to the ongoing emergency needs?
Sure, thanks so much, Jake, for the opportunity. Obviously, the situation is horrific. And the main point I would make is that we're talking about a very small territory comprised largely of civilians who are embodying fear and terror. There's no safe place for them to go. Many of them now have tried to seek protection and shelter in our schools. About 57,000 have fled into those buildings, with the understanding that only the UN flag above their heads may serve as their only form of protection from airstrikes. As you know very well, unlike most situations of armed conflict, these civilians cannot leave the Gaza Strip and seek refuge in a neighboring territory. So it really is our schools that provide the only possible source of safety from the airstrikes. And then secondly, of course, I think I would highlight that this is the fourth armed conflict in the last several years. So if you are a child of 16 in Gaza, that means that this is your fourth war and you've never left the Gaza Strip. As the terrible fighting continues, of course, there's rising humanitarian needs in the form of very basic things like food, water, and shelter.
Let me just stay with you, Dr. Campbell. You mentioned that the schools are now being used as a safe shelter. So what does that do for any existing educational programming, and how and what services are you able to provide in the context of those schools? And are you even able to think about COVID-19 protocols, or is this just a situation of triage?
Right. So while sadly many in Gaza are used to armed conflict, the new element is indeed COVID. And UNRWA's healthcare team has been working very hard to mitigate the impacts of the disease. Unfortunately, we are just coming off of a huge spike in COVID cases. So what we're deeply worried about now is that as civilians seek shelter in our schools, that they will actually become super spreader places. We are actively providing PPE and trying to put in place, to the extent that we can, social distancing and other measures, but obviously it's extremely difficult. On education itself, of course, we are not actively teaching children in our schools today, but sadly, because of UNRWA's deep experience in education and emergencies, we have restarted our remote learning program so that kids can have a sense of normalcy and that they can learn while they're at home during this time.
Thanks. I want to turn to you, Dr. Sahloul. MedGlobal is an emergency health provider. And so can you speak to us today about what you're hearing from your staff in Gaza and what MedGlobal's response is to the emergency health needs?
Thank you for having me, and good morning to everyone. It's a catastrophic situation like what we have seen in the previous conflicts and wars on Gaza. I was in Gaza myself twice with medical teams that we sent by MedGlobal, diverse from the United States and from the UK, to share, actually to learn from our Palestinian colleagues, because I think they are the best physicians and nurses to respond to crises like this. They got used to that because of the prior wars in 2008, 9, 12, and 14, and then the sniper shooting at demonstrators after that. And also to provide training on certain technology like portable ultrasound, because of the blockade on Gaza that prevents certain technology from getting in that are necessary to treat the patients. What we are hearing right now from our colleagues in Gaza, that the situation is catastrophic, as Elizabeth has mentioned. Our staff are unable to leave their homes. They're sheltered in place because of the relentless bombing. There is a huge destruction of infrastructure that prevents patients' access to necessary health, including emergency surgeries that are needed for treating the trauma patients. More than 1,500 patients were injured, more than 216 were killed so far. Quarter of them are children, and there are also a number of women and elderly who were killed in the bombing. There are no shelters actually in Gaza. I mean, we're looking at two places that are receiving bombs. Of course, they're not equal, but Israeli citizens have the ability to go to shelters that will protect them from the rockets, but Palestinians in Gaza are unable to because there are no shelters. So they crowded in rooms in their houses, and that increases the risk of killing and injured from the bombing. Also, it increases the risk from mental health trauma that are very common after these type of conflicts. And there are very limited numbers of psychiatrists that can treat this for the long term. One of them was actually killed, Dr. Al-Alul, 3 days ago by the bombing that hit his house and took also the lives of dozens of his extended family. We're very worried about the killing and the attacks on healthcare providers like Dr. Al-Alul that I've mentioned. He's one of the few neurologists, psychiatrists in Gaza. Also, Dr. Ayman Abu Al-Auf, who is the head of the internal medicine department in Al-Shifa Hospital. Attacks on healthcare itself. Al-Rimal clinic was hit and bombed, and that was the place for COVID testing. So right now there's very minimal testing for COVID patients in Gaza. And also the attacks on electricity and internet that of course impede medical and humanitarian operations. Hospitals run on electricity and on generators, and if there's no electricity, it will be very difficult to treat the large number of injured. And also the long-term implications, not only on the injured patients, but also on patients with chronic diseases, on patients with cancer, patients with dialysis, who are all requiring a lot of attention, medications, and medical supplies that are very difficult to get inside Gaza.
So you mentioned that your staff are unable to leave their homes and access the clinic. So clearly that's had a disruptive effect on the services you're able to provide. Has MedGlobal done any thinking about the path forward and shifting the nature of your work and what this will mean for future operations?
Yes, I mean, fortunately, 1 week before this episode of hostilities or violence or war, we were able to get a large shipment of medical supplies that are catered for patients with chronic diseases, kidney patients, dialysis patients, and cancer. And hopefully we will be able to distribute this shipment of life-saving medications when the hostilities stop. I'm very optimistic that the ceasefire will be coming soon. But in addition to this, we are working with the Ministry of Health to assess the current needs of hospitals. There are 5 main hospitals in Gaza. All of them are in need for not only specialists, of course, and trained specialists, but also medical supplies, surgical supplies, certain technology, and rebuilding what has been destroyed, especially in terms of the roads leading to the hospitals, and the clinics that were bombed, the Rimal clinic, and basically upgrading the medical facilities that are there. So that will be our next stage, which is basically assessment of the damage and what we can do in MedGlobal to help in the rebuilding and the training and providing medical supplies and surgical supplies. Telehealth may be an option for us because of the logistical difficulties getting into Gaza in the foreseen future, I would think. I mean, Gaza is a big prison, as everyone knows. There's only two ports of entry from Israel and from Egypt, and both of them are very difficult to get into for physicians or nurses who would like to go to help. It is not easy, and but I hope that the neighboring countries will be opening more the border, so that way humanitarians, doctors, nurses, medical supplies, humanitarian aid will flow much more easier into Gaza.
Thank you. I want to come back to you, Dr. Campbell. Dr. Sahloul mentioned telehealth, and you mentioned the distance learning. So I'm just curious from the healthcare system, from your perspective, you know, even before this latest round of violence, it was the healthcare system was deeply negatively impacted by the blockade, as was mentioned. And so, you know, what is the status of UNRWA clinics? Are they operational? And is there, are you able to give us any sense of, you know, similar to the question from MedGlobal, of what the short-term and long-term future might be for the health services that you're able to provide?
Yeah, sure. Thanks, Jake. So just by way of comparison, in 2014, UNRWA was able, during the war in 2014 in Gaza, UNRWA was able to keep all of its 22 healthcare clinics open throughout. But given the particular intensity of this fighting this time around, UNRWA actually had to close its healthcare centers for a few days. Right now, 16 out of the 22 are operational. But as you may imagine, many families are simply unable to access them given the violence and overall lack of protection. I think, you know, for UNRWA, you know, and my colleague mentioned this, and one of the issues that we're deeply, deeply concerned about is the psychosocial, mental health and trauma in kids, adults, and families. And here, we simply don't have the adequate resources that we need to respond effectively to these compounding tragedies. We do have a robust program, but it's something that will need to be fully funded and expanded to begin to be able to just touch the surface level of the trauma that people are now living with. So that's something I know that we'll focus on in the future. But overall, in terms of healthcare, obviously we're deeply concerned about COVID, as we already mentioned. We know now that this violence will potentially lead to super spreaders, and of course the challenge is the access to vaccines. A very, very small percentage of the population has access to vaccines. If we compare the current COVID levels in Gaza with, say, India, that's currently dominating the news, the rate per capita is much higher, and the access of it to vaccines is much lower. So it gives you a sense of the vulnerability. But overall, of course, UNRWA's own budget will need to be fully funded this year, as well as our emergency appeal, which we just released today, for us to be able to provide adequate healthcare moving forward.
Let me just stay with you then. Besides for the appeal, which I'd like to come back to in a minute, there's been extensive calls on this from the Security Council bilaterally on the need for a cessation of violence, although as of today, that doesn't seem to be on the horizon. What other steps should the international community be taking, or pressure being applying, with a focus on the humanitarian work in Gaza? We've talked quite a bit about the blockade and the minimal entry and access points. Is UNRWA still able to move material and personnel through the areas or other crossings? And is there a need for, you know, a paradigm shift in how that operation works? And are you thinking a little bit about, you know, the immediate but longer term, just that humanitarian picture in terms of the movement of goods and personnel into and out of Gaza?
Right. So there's basically three asks, and you've touched on them. The first, of course, is humanitarian access. Since the hostilities began, UNRWA has not been permitted to either move its humanitarian personnel into Gaza or out of Gaza. There are currently 8 unessential UN staff in Gaza that we've requested be removed, and we haven't been given the permission by the Israeli authorities for them to be evacuated. That's obviously deeply concerning. But in addition, we've been trying to secure entry of both our Commissioner General and also our head of security. The rest of the UN is looking to bring in trauma coordinators and other essential personnel. That personnel has not been permitted entry. Similarly, we're having the same challenge with humanitarian assistance. As of today, no humanitarian assistance has moved into Gaza. The Karim Shalom crossing was open for a very brief period yesterday, but humanitarian assistance, including food, did not cross over. So humanitarian access is obviously a key concern. Secondly, a humanitarian pause. That means basically all parties to the conflict agreeing to cease fighting temporarily so that humanitarian workers can access the populations in need, but also so that civilians can access the vital supplies that they need for their families, food, water, and other things. And then the third piece, which I mentioned already, of course, will be robustly funding the humanitarian appeals so that humanitarian assistance can reach people immediately.
Thank you. Dr. Sahloul, you mentioned the loss of the death of 2 of Gaza's top doctors, both the head of the coronavirus response and the neurosurgeon psychiatrist. And MedGlobal works in 11 countries around the world, and there's this sense of these reverberating effects when not just when people are killed, but when medical providers are killed, and the inability to then be able to provide essential services for the population. Can you speak a little bit more about the consequences of the loss of these doctors and how what that means going forward for the healthcare, both in the emergency context and beyond?
I mean, this is the most horrible thing that we have witnessed in the last 10 years or so. It looks like it's a trend that has started in Syria, which is, by the way, my homeland, where we had, according to Physicians for Human Rights, more than 930 doctors and nurses and medics who were killed, mostly by the Syrian regime and Russia. More than 580 hospitals were bombed in Syria. MedGlobal is a member of Safeguarding Healthcare, which is a global coalition of humanitarian medical organizations and even UN agencies that care about attacks on healthcare, because this undermines medical neutrality and impartiality. It is against international humanitarian law. They are war crimes if you're targeting healthcare providers or ambulances or hospitals. It undermines 150 years of progress since the Geneva Conventions. So we're really worried about this, especially in areas like Gaza, where you have shortage of healthcare providers and specialists in certain medical and surgical specialties. There are not many neurologists in Gaza. So when you lose someone like Dr. Mouin Al-Aloul, who is one of the senior neurologists, then that means patients who have stroke or headache or back pain or seizures or brain tumors will not have access to neurologists to treat them. Many of them will not be able to travel outside of Gaza, cannot afford it, or logistically they cannot travel. So they're trapped and they will succumb to their illness without treatment. The same thing when you have a senior physician like Dr. Ayman Abu Auf, whom I met in our first medical mission to Gaza, one of the smartest and more dedicated physicians in Gaza, who got his training in Germany and Jordan, and then decided to go back to Gaza to serve his community. He was the head of the COVID response in Al-Shifa Hospital, which is the largest hospital in Gaza, and he was the head of the internal medicine department. He refused to open a private clinic because he is dedicated to treating his patients, and he was killed with 8 members of his family few days ago. And it's very difficult to replace these senior physicians who have technical and administrative skills. When you kill one doctor, you're killing 10,000 or 15,000 patients who will not have access to healthcare on the foreseen future. Physicians in Gaza don't have the luxury of traveling to get to update their medical knowledge. They don't have even the luxury sometimes to use the internet to update their medical knowledge because of the poor quality of the internet and the constant disruption. They don't have the luxury like what we have in the US, where we can subscribe to sites like UpToDate to update our medical knowledge, because they cannot afford to do it. Most of them will get salary, which is about $400 a month every other month. So not regularly, especially after we, the United States, cut our aid to the Palestinian authorities, and after Israel also prevented tax return to go to the Palestinian Authority. So all of these factors will add to the hardship and the scarcity and the shortage of healthcare providers. Of course, disruption of the transportation of patients to hospitals, diversion of the medical care now focused on trauma. That means you're going to forget patients who have other issues, who may die because of their chronic diseases, heart attacks, pulmonary embolism, COVID. Disruption, all of that will be very difficult to replace in few days. And also, slowing down the vaccination rate. Elizabeth mentioned that the vaccination rate is very low in the Palestinian territories. About 4.5% only of the population have been vaccinated in Gaza, compared to 60% in neighboring Israel. And of course, this is something that every physician, every humanitarian, every policymaker should be questioning. Why is it that we have 60% in one country and only 4.5% in another country that is very neighboring to that country? And the population of Gaza are, frankly, the responsibility of the Israelis in terms of providing equal healthcare. This inequality of healthcare is one of the worst diseases that we are seeing, and it is terrible situation. We've seen disparity in healthcare in the United States, but over there it's much more heightened.
Thank you. I wanted to ask you both about sort of the concept of duty of care for the staff of the organizations they work for, and what you can tell us about the experience of your colleagues. Dr. Sahloul, before we started the call, you're a practicing medical doctor, and we were speaking about just the strains that you're experiencing in the United States of working in the COVID environment over the past year. So you can imagine that the stress on medical providers or humanitarian relief workers in Gaza, even just from COVID before this round of violence, has been extremely difficult. So I'll stay with you, Dr. Sahloul. Can you just share with us a little bit about what you're hearing from your colleagues? Then we'll come to you, Dr. Campbell.
Yeah, actually, even before this crisis, I had the pleasure to talk and to train with my Palestinian colleagues in Al-Shifa Hospital, also in Nasser Hospital in Khan Yunis. And what I've witnessed among the intensive care unit specialists and also the nurses, that they have clearly signs of PTSD, although they don't admit it, and they have signs of depression and anxiety. They are unsure of their future. They're demoralized not only because of the siege and shortage of technology and inability to treat their patients, but also because of the low salaries that cannot sustain their families. They cannot travel outside. So all of this is adding to their hardship. And now you have this war again, and the violence that is affecting them may lead to loss of their family members, their colleagues. I've received many messages from the doctors and the nurses in Al-Shifa Hospital who were colleagues of Dr. Ayman Abu al-Auf, who are grieving his loss. And these things are very difficult to treat. Doctors are not the best patients. I've known it from my experience here in the United States, where we had a large number of the nurses and the physicians who got issues related to mental health and psychosocial trauma because of COVID, and the large number of patients that we were receiving that overwhelmed the healthcare at one point in my hospitals in Chicago. So imagine if you were a doctor or a nurse or a medic in Gaza, with your hospital is being overwhelmed. You cannot treat the patients who are coming injured. You are seeing these pieces of children coming to your hospitals, and you have nothing to do, and then you have the families crying, and and you have the bombing continuously. You cannot protect yourself or your family. All of these are adding to the mental health trauma. It will be very difficult to treat. I mean, we ask our physicians here and nurses to take breaks, to meditate, to exercise. We provide them with a lot of resources, with counselors. There's no such luxuries in Gaza or other places like Yemen and Syria and other places in the world. So I think there should be more calls for policymakers to provide these resources to physicians and nurses so they can treat their patients in Gaza.
Thanks. Elizabeth, the same question to you. What are you hearing from your colleagues in Gaza, just the personal toll that they're experiencing from their work and from the scenario?
It's a really great question, Jake. And Dr. Sahloul spoke so eloquently about the impact on healthcare workers, which is, I obviously have experienced myself from speaking directly with them. I would just add to that, UNRWA runs a large scale education system in Gaza. We have over 285,000 students. And now we have lost 18 of those and 61 children altogether. These are kids who in many died in their homes or who are walking home from the market. So, the traumatic long-term impact of having to work in places where children are killed is almost indescribable. And so I think when I heard your question about, responsibility of duty of care, it's a difficult one to hear because it's actually something that UNRWA can't afford to do. And again, as I said, this is the fourth time in the last 16 years where staff and beneficiaries are having to absorb this trauma, and it doesn't go away. They're still rebuilding from the last time. I think you may have seen that of the psychosocial programs that we are able to offer children who have been so deeply damaged by their experiences and exposure to violence and war. Many of those who were in our program have actually been killed this time around. So, I don't have a good answer to your question except to say that all that we are doing is inadequate, and it's certainly not even close to what should be required for the level of trauma that people are experiencing.
Just obviously very tragic. And I want to refer back to something you said earlier on the education, where you talked about how, as a context of the long history and how UNRWA has had to work, but also in COVID, that the virtual education is something you're able to sort of think about kicking up again now in the context of the violence. It's a little bit sort of macabre to think about, but this is not the first round of violence that has severely disrupted UNRWA's work. So kind of the same question I put to Dr. Sahloul before, even as you're appealing for the emergency needs, are you able to start to think about what it will take to reconstruct and rebuild the facilities and kind of that essential infrastructure for the civilian population of Gaza?
Right. I mean, I think that it's almost cliche to say that Palestinians are brave and resilient, and that's true because they have no choice. But this one I think will take a toll because people are coming out of the COVID experience, and now 15, 16 years of blockade. But yes, of course, I mean, UNRWA will be at the center of rebuilding both the physical infrastructure and the human lives. So that will mean, appealing to donor states to physically rebuild our schools. It will mean appealing to donor states to, increase the amount of humanitarian assistance to the families who lost their homes and who will need emergency cash assistance to find shelter once the war ends and they're able to vacate our schools. Of course, it will continue to mean the provision of food assistance to over 1 million people, which in and of itself is a tragedy to think that half of the population depends on us for their food. And then, of course, the main goal for us will be to reopen our schools as soon as possible, because that is the most important thing for Palestinians in Gaza, their access to education. They care about it more than any other service that is provided to them. It is their only ticket to the future and to a life potentially that connects them to the world outside of Gaza. So that is something that we're deeply committed to. Of course, again, UNRWA is very adept at, working within these crisis and conflict situations and finds ways to keep school going throughout all of this. And that certainly will be our goal moving forward.
Thank you. Before we conclude, I want to give you a chance, Dr. Sahloul, if there's any final message you might have or area of your work that we haven't covered before we wrap up. Do you have any final thoughts you'd like to share?
Well, thank you, Jacob, and for CSIS to address this very important issue. A few things, as Elizabeth have been talking about their plan to rebuild and reconstruct. We are committed in MedGlobal, like the other organization, and there, by the way, only few NGOs that are working in Gaza because of the logistical hardship and difficult landscape to rebuild what has been destroyed, emphasizing on sustainability and building resilience within the local community, providing training to our nurses and doctors in Gaza, which is much needed, especially in certain specialties. There is a shift in the United States and in the world towards more digital health and telehealth. This is something that I think the international community and our country can help in Gaza. But in order to do that, we need to make sure that they have adequate internet infrastructure, which is not the best. It's one of the worst in the region. Also, when we talk about having physicians treating their own communities, which is, the key is very difficult to provide physicians and nurses from outside. That means they have to have adequate income. So any assistance in terms of providing income to our Palestinian colleagues in Gaza and the West Bank and increasing their salaries so it can sustain themselves and their families. By the way, many of them work as volunteers in hospitals and clinics because there's no salaries for them. I think that's very important. Providing with technology like portable ultrasound, MRI, CT scans. There is no radiation oncology in the whole Gaza for 2.1 million people. So people they have cancer, they have to travel to the West Bank or Israel or Egypt to get treatment. These issues are necessary. And also, let's not forget chronic diseases. What kills more people during wars and conflicts actually is not the trauma, although trauma is horrible and you can see it on TV and on pictures. But patients who have kidney disease and cancer and heart attacks and chronic pulmonary diseases like COPD, who don't have access to clinics or hospitals to treat their common conditions, who are not able to afford their medications, to buy their medications. These are the ones who die more than patients with trauma, but these are not kind of graphic pictures or videos, so we don't see it. And I've done a study in Syria where 300,000 people died because of chronic diseases, but of course we focus on the trauma and the victims of bombing. So let's not forget chronic diseases. And let's not forget COVID, which is now being diverted, the resources diverted to treating trauma patients. Last year, we were able to provide about $8 million worth of medical supplies for PPEs, PCR machines, ventilators, oxygen. We're worried that the hospitals will be overwhelmed with a third surge of COVID patients in Gaza. And we appeal to the international community to help to provide more resources to our Gazan colleagues in order to address that.
Thanks. Dr. Campbell?
For us, UNRWA is an infrastructure or a human development program in addition to the humanitarian assistance that we provide. So for us to be able to operate, we need to be able to pay our staff. The majority of our staff are Palestine refugees themselves, right? So that means that our existing appeal needs to be fully funded in addition to what we're asking in our emergency appeal. If we're not fully funded, we can't afford to keep our staff who are doing this essential work. It's the Palestinians themselves who are running our schools and our healthcare system. So, I think that's the important thing. And maybe I would just also take this opportunity to say that, we are the alternative in Gaza, right? We are a UN organization based on UN principles, including the commitment to human rights, conflict resolution, tolerance, and equality. that is what we project. That is what our staff project. That is what we continue to strive and aim to achieve. And I think that we're worth investing in, and certainly the refugees and civilian population in Gaza need us.
One more thing that I think our media and policymakers should be really focusing on this humanitarian issues. I tweeted about the loss of Dr. Al-Alul a few days ago, and my tweet was retweeted by more than 10,000 doctors and nurses from all over the world because they care about what's going on to our Palestinian colleagues. I don't see that resonated within our media here in the US, or policymakers, senators, and congressmen who should care about the plights of Palestinians, whether they are doctors or nurses or children or women, and they should be vocal about these issues. They have not been vocal in the last week or so. And I hope that we, as the country that has the moral, I would say, sets the moral trend in the world, we should be also reflecting that in our messaging to the rest of the world, because people are looking at us and they're listening to us. And if we don't say what's right, then people will get very disappointed.
Thank you very much. And thank you both, Dr. Sahloul, Dr. Elizabeth Campbell, for taking the time to speak with us and for the work that your organizations continue to do. And thank you to our viewers, and we will continue to follow this issue closely.
Thanks so much, Jake.
Thank you.